Also joining us tonight is Marcos Melitsas, creator of the Daily Kos blog and author of Taking on the System, Rules for Radical Change in the Digital Era. Good evening, Marcos.
Good evening, Lawrence.
Marcos, the Senate bill, I think to no surprise at this point, has no public option in it, but it does have state-based exchanges and states' policing of the insurance companies. If that's the arrangement that emerges from the final conference version of this bill, should that bill get support by liberals?
Well, you know, I've been saying that this bill is not health care reform. It's definitely not reform. What it does is it allows more people to buy into the existing broken system. And there are a lot of people who need insurance, but what's happening is that even people with insurance cannot afford health care because of the copays and high deductibles and out-of-pocket expenses. So I'd like to see something being done to address the cost side of the equation. I mean, you have the federal government now on the bill, on the tab for the insurance of 15 million people. You have a middle class that's not going to get much relief in this bill, continuing to pay these out-of-control health care costs. So we need to see more work done on the cost side. Now, I'm really encouraged by the notion that maybe Obama now thinks it's okay to allow cheaper drugs to be imported from Canada. That's a huge first step, because I think the insurance companies have gotten a lot of the venom, but also a lot of the reason for the high cost is the drug companies and also the healthcare providers. So at worst, this could be a first step towards full health care reform, not just increasing access to insurance.
Well, the biggest cost containment measure in the Senate bill is the tax on union health care plans, which the CBO, in its analysis, says will force those health care plans to cut benefits. That's the method that the Senate bill is using to contain costs, forcing a cut in benefits through a 40% tax, a confiscatory tax, in effect, on these health care plans. That's one of the issues that has been listed as a reason to oppose this bill by liberals online in certain places. Is that something that you could support? Obviously, I'm getting the feeling that the House of Representatives now is going to flip-flop on this completely based on what I just heard from Congressman Waters. They're going to vote for that thing.
I think it's unconscionable, because a lot of the people who enjoy those kind of plans are blue-collar workers who are in high-risk fields like police, firemen, or are blue-collar people who have given concessions, union workers who have given concessions on wages in order to keep good benefits. Now, if anybody thinks that concessions on the benefits are somehow going to lead to higher wages, it's high, because that's not the way the business world works. People have negotiated those. Now, if you create a cap, let's say everybody making over $125,000 or $100,000 with a so-called Cadillac insurance plan, if they get taxed, I'm less concerned about that. But when you're talking about blue-collar, working-class people being penalized for having good benefits when their wages have sure not been increasing in recent years, I think that's unconscionable.
Now, it is one of the reasons, along with several others, that Fire Dog Lake lists in their top 10 reasons to kill the bill. What's going on in the liberal blogosphere? Is this, in effect, stunting in the sense that they're trying to continue to push the bill in what will be conference now in a liberal direction, or do they really mean kill this bill if it has these elements in it?
I think it means improve the bill. We're not done fighting. I have to say that there is a fairly big split in the progressive online community between those who just want to take a deal, anything, and move on to the next big issue, and those of us who haven't quit fighting. I have to say, the reason that Obama is now talking about drug re-importation, cheaper drugs from overseas, is because we are continuing to fight. If you lay down arms, you know what, the Ben Nelsons, the Joe Liebermans, they keep extracting concessions. We cannot at any point lay down our guns and stop fighting. Once we have a final bill and things are set in stone, then we can re-examine that bill. But right now, things can still change, and to stop fighting for that change, to me, is really patently ridiculous. Any positive change from here on out is going to be because we keep pushing from the left, not because we say, good enough, let's pass it.
Marcos Melitsas of the Daily Kos. The Daily Kos never stops fighting. Thanks very much for your time tonight.
Thank you very much.